Hey guys, Dr. John and Olivia here again. Thanks for joining us. Today we are going to talk about how neuropathy affects you and your loved ones. It can be so life-altering, or maybe more correctly stated, life-stopping. So let's dive in. The staggering fact is that peripheral neuropathy is one of the most common chronic diseases in the US today. 8% of the US population suffers from peripheral neuropathy, which is about 24 million people. So that means in Lincoln, Nebraska, that's about 24,000 people. So you aren't alone in your struggle. You may be wondering, is this only found in the older population? No, it can happen to anyone, usually between the ages of 30 to 101. And maybe you've heard that only diabetics can get peripheral neuropathy. That's also not true. While diabetes is one of the leading causes, many causes are idiopathic, which just basically means no one knows what caused it. So it could be from medication, chemotherapy, injury, peripheral artery disease, Agent Orange exposure, and over 100 other reasons. So remember, in the last video we talked about how peripheral neuropathy can affect different types of nerves. Each nerve type that it affects causes different signs and symptoms. So let's look a little bit further into that and see what you or your loved ones might be suffering with due to neuropathy.
All right, so if the large fiber nerves are affected, you're most likely struggling with balance and coordination, and that can be a big problem. With that struggle leads to falls. 1 out of every 3 seniors experience a fall every year, and then 20 to 30% of those falls, they suffer moderate to severe injuries, including bruises, hip fractures, and even head traumas. And unfortunately, 10% of those falls are fatal. When I worked in home health, I saw this all the time. My patients would have to stop when they stood up just to catch their balance, and we would infamously call some of the patients furniture surfers or furniture walkers, because they'd have to surf from one thing to the next in their home just to be safe. Others would have those short little shuffle steps just so they didn't have to pick their foot up off the ground as much, and they felt a little more safe. But what that did is it led to people stubbing their toe on things, tripping over rugs, hitting corners and furniture, and leading to falls anyway. And falls that are no joke. I spent the better part of my career so far teaching people how to improve themselves and improve their balance so that they could avoid those falls. Now, switching gears, if the small fibers are affected, you're probably experiencing things like pain, sharp, deep stabbing sensation known as pins and needles. You might have numbness, tingling, pinching, or a shocking sensation. The problem is that when that happens, patients often don't know if they've cut or injured their toes or their feet.
Right. When I was in nursing school, actually, we were told a story by one of our instructors about a grandmother who was visiting her family, and when it was time to leave, she slid her feet into her shoes, just like we all do on our way out the door, said goodbye to everyone, and headed home. The problem was that her grandchild had been playing by the front door with his Legos, and one of them had accidentally fallen into her shoe. She couldn't feel it when she put her shoe on and walked around on it for the rest of the day. And by the time she took her shoes off that evening, the Lego had created a large wound in her foot. And as we learned before, neuropathy is ultimately caused by a lack of blood flow. So the wound was unable to heal, and she ended up, unfortunately, having an amputation of her foot. There are 80,000 amputations annually in the US, and peripheral neuropathy is the #1 leading cause of amputation. And leading in lastly to C fibers, they let your brain know what the temperature of your feet are. When we have damage there, you might get a sensation of freezing pain, or you might feel like your feet are on fire, even though they are at a normal temperature. So if you are watching this to find out what your loved one is dealing with every day, hopefully you understand how emotionally taxing this amount of unseen pain can be and how much it can affect their everyday life. And if you're watching this and you have peripheral neuropathy, we want you to know that we hear you. We have seen those just like you, and there is an answer. It can get better. It doesn't just have to be hidden. It can actually get better, get corrected, and you deserve that. And we feel that you deserve that. So again, if you have any questions, are interested in coming in for that free consultation just to learn some more about it, feel free to give us a call. Our phone number 531-500-3259. We would love to take care of you. Thanks again for watching.
Thanks, guys. Bye.